The reason that we did all of this is because we care. We care about our jobs. We care about our patients and our communities.
It's important to be part of a union because you have to have a voice.
Welcome to Union Talk. I'm Randi Weingarten.
Hi, everyone. This is our first edition of Union Talk for 2025. And yes, it's January 16th, and the new administration takes over on Martin Luther King Day, January 20th. But I don't want to talk about the new administration. And even though we had some really good news at the end of the calendar year, in that we had been fighting for about 40 years or so to try to get Social Security fairness for the people who are in public service that have gone back and forth from public service to private service, meaning they may work as a teacher and then have a part-time job, and they would never get their Social Security for what they had paid into, and that got fixed at the end of the year with Joe Biden signing that bill, his last public bill signing at the beginning of this year. I don't want to talk about that either. We'll talk about that another time with some of our amazing retiree activists who fought for that. What I want to talk about today, and I have two remarkable members who are with me today. So what I want to talk about is the largest, biggest healthcare strike that has ever happened in Oregon. And that started last Friday, almost a week ago, against the Providence hospital system. Now, there are 5,000 doctors, nurses, and other healthcare workers who are on strike. And I had the honor to be with them the first 2 days of that strike. And why are they on strike? They're on strike because they're standing up for their patients and themselves. In this hospital system, there's about 7 hospitals and other kinds of workplaces as well. In this hospital system, there has been this huge issue on safe staffing, on making sure we have sufficient staff for our patients so that we can do the work that our healthcare providers, all of you know I'm a teacher, I aspire and could never even dream. I aspire to actually just be in the presence of healthcare workers. I could never even be a healthcare worker. But what they do is, from COVID on, even before COVID, the amount of work, time, and attention these workers give to their patients are remarkable, and they're treated terribly. And in fact, because safe staffing was such a big issue, in Oregon, we got a huge law passed last year. Then instead of implementing it with fidelity in the Providence system, they're ignoring it. So that's part of why people are on strike, but they're also on strike for fair pay and for other fair conditions. And the fact is, this is a healthcare system, and the healthcare benefits that they provide are terrible. And so for the first time ever, we have doctors and nurses who are on strike at the same time. And this huge behemoth of a system, Providence, didn't want to deal with them at all. But the fact that we have such solidarity and unity on the lines, even though it's really cold, what's happened is Providence said that they will finally bargain in good faith. They're spending more money on trying to break the strike than to solve the issues around the strike. And it is the unity of these nurses and doctors together that are really trying to fix a broken healthcare system, and Providence is Exhibit A of that broken system. So I want to welcome Rebekah Van Dyke, a med-surg nurse at Providence Milwaukee Hospital, and Dr. Lesley Liu, an internal medicine and pediatrics hospitalist at Providence St. Vincent's Hospital, to Union Talk. So I want to say to Rebekah and Lesley, thank you so much for being with us today, and we really appreciate it. And I know you've been on the line, and so this is like double duty for the day. You're several days into the strike. So I just want to ask both of you right now, how are you doing? Let me start with Rebekah, and then I'll go to Lesley.
I'm doing good. I almost feel as though I've been more active this last week than I would during a normal work week. Been putting in the hours, spending lots of time with coworkers, trying to keep spirits up, riling each other up about why we're doing this, standing in the cold, remembering that this is a bigger cause, that we're taking care of each other.
That's great. That's great. Lesley.
I think I'm doing okay. I had so many different emotions. I have some moments of anxiety about what's going to happen. I've been angry and disappointed at kind of the games that Providence has been playing with us, where they alert the media that they are going to bargain with us, but then don't communicate with the union or give us any dates to bargain and kind of try to catch us off guard. But, whenever I get into those moments of anxiety and fear, going out on the line has been really uplifting and reassuring to me. I didn't think I was going to go picket as much as I have, but I've gone almost every day because I think it's really makes me feel better personally. And then also gives me the opportunity to talk to other people and just try to keep spirits up as well. So we're all really working together out there. And so that's been a really encouraging thing for me.
So, Rebekah, tell me a little bit about yourself. Why did you become a med-surg nurse? How long have you been at Providence? And then I'm going to, talk about the strike for a bit.
Well, let's see. I was born in South Korea, going back a little bit far, but I was born in South Korea, adopted as a baby. I was born with a cleft palate and a cleft lip. So hospitals and doctors and nurses have always been a part of my life. I've had a lot of those procedures growing up. And then also around the age of 5, my maternal grandmother moved in with us, and she was wheelchair bound. And
oh, wow.
Every morning I would go in there as a little 5-year-old, watch her take her fistful of pills and watch her inject her insulin into her belly. I used to help her put on her compression socks so her feet wouldn't swell in the morning.
Mm-hmm.
So she was also kind of my first patient. And I used to go with her to all of her doctor's appointments, all of her hospital stays as well. So between her and I, it's just always been a part of my life.
That's amazing.
It took me a while to fully realize that I was supposed to be a nurse. It was something that I always knew, but to be ready to work towards it and actually put in that effort took a while. I've been a nurse now for about 1.5 years. Providence was my first nursing job. I've been at Providence Med-Surg, Milwaukee, for about 1.5 years.
I think I remember you saying at one point or another that in that first year, 9 med-surg nurses left. And med-surg, nursing is hard anyway. Med-surg is really hard. So 9 med-surg nurses left in your first year for better pay?
Yes, I don't know where all of them went, but I know at least one went to a cardiac unit. I believe it was OHSU. I know at least one went to OHSU for the better pay. And I don't know exactly what happened to the other 9, but I assume it was for better opportunities, either whether that be work conditions, pay, benefits, the environment. So yeah, after 1.5 years, I'm not considered a veteran, but I am considered one of the more experienced nurses. Some of the people in my cohort that I started out with have precepted nursing students, and now new grads come and ask us questions, which, is fine. But at the same time, it's, when any given day, I look up at the board to see who's here, and there's maybe 2 really experienced nurses at a time.
Wow.
And so we all help each other out. Everyone's always willing to learn and lend a hand. But there's only so much you can't replace experience. There's nothing that can give you that except for time. And once you get that time and that experience, like Providence really just needs to hang on to that.
Right.
And because that's what makes us stronger. We need more diversity. We need the young, we need the old, everything in between.
And, the way in which I know, these Providence hospitals, you can see the contrast here that it's a $30 billion corporation. The CEO made more than $12 million last year. The hospitals are dangerously understaffed. They're violating the new safe staffing law. And so it felt like, there was really no choice but to go on strike. But let me just ask you, as you were thinking about going on strike, there was a time-limited strike in June as well. You were one of our units. For those who don't know, the AFT has now become the second largest nurse union, and we're one of the fastest growing healthcare unions, if not the fastest growing in the country. But it's not an easy decision to go on strike. So what was the trigger for you? When was it you saying to yourself, oh my God, enough is enough?
We heard from our bargaining teams that they were making proposals, they were doing everything they could, and it just felt as if they were getting nothing from Providence. They would spend hours at the table, and Providence would come back with maybe a little bit of, like, only one proposal or one section of the proposal had any changes, and the rest was nothing. So
Right.
It's like you're spending all these hours and you're not even really doing anything. And then for me, Providence has done a lot of penny pinching, a lot of cutting of just various programs. They recently cut a translation service and a home health service. And also the big thing for us is they outsourced their lab services to LabCorp. And it has been awful for patients. I had a family member go in for routine blood work that should have taken like 15 minutes tops. They waited for 45 minutes and finally were like, I have to go. I can't sit around. And they had to change their doctor's appointment because they needed that blood work prior to the doctor's appointment. So they had to push their appointment. And so then when Providence puts out, oh, patient care, you want to care for our communities, it's like, well, you're not. That is affecting the patient care, and you're doing that to save money. And Another thing for me is just within the facility, they're always finding ways to pinch pennies. And whenever we ask for something, like when we need our windows fixed, they cite, oh, well, we can only fix a couple windows because each window costs $10,000 to fix. And they tell us that as if the price is going to win us over, as if that's going to wow us. Or try not to use too many of the warm blankets because those cost $3 to launder each. Also, a bladder scanner, which is an essential thing to our unit, very basic. Our manager couldn't just order one. She had to request that an order be put in. So it's like almost like with the insurance type thing, you have to ask your insurer if it can be covered. And again, citing that it was thousands of dollars. If you're saving all this money, where is it going? If you're not going to make our wages competitive, will you at least put it into your facilities? And I don't see them even doing that. And so for me, that's frustrating. Where's all this money going then, if not into the community that you claim to care for?
Right. So that's a whole lot of really important, righteous and moral reasons, being so disrespected, which is like, do as I say, not as I do, is what I'm hearing you say. And so disrespected in terms of, trying to actually do the job. And that LabCorp thing, I've heard that several times when I was there last week. I've heard like what it means when the labs are outsourced. How do the doctors, how do you do what you need to do when you don't have the data? And so, Lesley, I know that you are sick and tired of all the decisions that are being made about patient care, not directed by frontline caregivers like you, but by the C-suite and the corporatization of healthcare under Providence management. So you want to talk about that because it is really historical that doctors are striking with nurses right now, and we're honored to represent both units. But you want to talk about that a bit? How long have you worked at Providence?
I've been there for 16 years now. So it's
Wow.
the first job and only job I've had coming out of since residency.
And why create a union? Because that was a pretty big thing for the hospitalists to do. I am not, for the people who are listening, I am not saying hospitalists. I am saying hospitalists, which are doctors who work in hospitals. So for those who have never heard this term before, that's the term I'm using. So why Providence? And what has changed over the course of these 2 decades?
The thing that really drove us to decide to unionize was the issue of staffing. You know, over the course of the 16 years I've been there, there's just been a gradual increase of the numbers of patients that we're expected to see, as well as an increase in how complicated and how sick they are also. When I first started 16 years ago, the target was for us to see 12 patients a day. But I mean, even seeing 12 patients today compared to the kinds of patients we saw when I first started is a bigger burden, just because the people that are coming to the hospital are a lot sicker. And we just really haven't been able to have much input into how we're staffed or how things are run. I mean, we do have a committee, a department where we talk about these things every month, but basically every month, the discussion for the past 7-8 years that I've been on this committee, every month we talk about staffing and how we need more staffing, and we just aren't getting it. And it just felt like we weren't being listened to. A lot of decisions get made without us getting much input. One example is that the university hospital in town that was doing all the heart transplants and taking care of all the heart transplant patients, their program got shut down. And so Providence took on all of those patients, and St. Vincent's was the hospital where a lot of that care is based. And we're just told, you guys are going to have to take care of all these heart transplant patients. And they gave us a 1-hour PowerPoint talk over lunch. And that's basically all we got. And they're like, okay, now take care of these patients. They've also started moving a lot of patients that would typically, and in the past, even at St. Vincent's, be in the ICU or the intensive care unit. They've been moving them to be cared for in the intermediate care unit. And so all that patient care falls onto us as well. These are patients that in other hospitals would be in the ICU, but in St. Vincent's, they're cared for by hospitalists as opposed to critical care specialists. And so we are getting a lot of those sicker patients on our plate as well.
So it's almost like you're on this treadmill going faster and faster and faster and faster and not having any kind of time to really do the level of care you want to give.
Yeah, it's getting harder to do that. I feel like they're just kind of taking advantage of our desire to help, just seeing how much they can pile on to us before we break or push back. Several years ago, they also floated a plan to have the hospitalists in our program, because we are one of the bigger programs, serve as backups to these hospitalists at the smaller programs because they're understaffed. But we're understaffed too. And so we actually, as a group, kind of put our foot down and said, we can't do that. We're not going to do that. And that was actually effective. So I think that was kind of our first taste of what you can do when you're united as a group.
Right.
Stand up for your safety and well-being.
I have found, it's been my experience, that workers who are on strike together create a lasting bond that never goes away. I remember when I was a kid and my mother was on strike for 6 weeks, the people that she was a teacher in New York, in the suburb of New York, and she lost 2 days' pay for every day she didn't work. And so those bonds that she had with the people that she walked the strike line, those bonds never, ever, ever left. And it was like years and years and years of them being friends because they did something to help themselves and to create power that they should have had anyway, but they didn't because the employer was so disrespectful. And I think that's when I saw all of you on the line on Friday and on Saturday, I felt the same way about the Providence strike, that the employer is so, I don't know if it's neglectful, I don't know if it's omissions, I don't know if it's intentional, but so thin ear or mean or just can't believe that the employer has to actually deal with the issues, that I think that there's an arrogance there that I frankly never used to expect in healthcare. Like in healthcare, I used to think, people would bend, or at least they would pretend that they cared about the workers because they knew the workers were the only way that they could get to their bottom line. Let me ask you this question. What do you think is the most important thing that could come out of this strike? The strike will be over at one point or another. It's different than the summer. It's an open-ended strike, and it's not going to be over until there's a contract. What's the thing that when you, like in a year or two, you'll say, that was worth doing because X happened? What would that be? Lesley, I'm going to start with you, and then I'm going to go to Rebekah.
Okay. Well, I think the thing I wish would come out of this is that I think there's kind of a misunderstanding from management as far as what they believe our motivations are, because we really, I think the big thing we want is just to be able to just be involved in the decisions about how patient care is delivered at the hospital, that we just want a seat at the table and to actually have an actionable voice, not for them just to be, yeah, we hear you over there, but we're just going to do what we think is best. And I wish that they would understand that we want to work with them. We're not trying to work against them. I feel like it's turned into such an adversarial relationship. And that's not what we want. We want to work together.
Right.
'Cause I would hope that we all want the same thing, to just provide high quality, safe patient care.
And you want them to respect you.
Yeah.
And your voice and your practice area.
Yeah.
Right? Yeah.
And the fact that we know all the nitty gritty about how things work in the hospital. And I think we have a lot to contribute about making suggestions for efficiency and safety and cost.
Right. And Rebekah, what about you? It could be like wages, it could be staffing, but it could also be this visceral sense of, I want to be listened to, which is what, sorry, Lesley, I said it in my words, what I heard you say.
I want Providence to respect its workers, and I want us to be I want people to want to work at Providence because I need help taking care of my patients. I need help taking care of my community. I live in Milwaukee. I live less than a mile away from where I work. I take it very personally whenever Providence tries to throw, we need you to take care of the communities. This is my community. Right. Don't talk to me like that. And we look at other healthcare systems that are just as large, if not larger, such as Kaiser, $0 deductibles. Providence is a health insurance company, and they just kicked off their employees off of their own insurance and gave them Aetna. And people are shocked at that people have these conceptions that, oh, if you work in healthcare, you probably have really good health insurance.
Yeah.
People probably think that, oh, you're a doctor, you're the boss, you get to help make all these rules, you get to run the hospital. And I think they would be surprised to find out that they don't. I'd like to get rid of some of these incorrect misconceptions and break the myths and really call out that Providence is a corporation. They're acting like one. They hide behind a nonprofit. We're not just greedy, whining nurses who are whining about making more money. There are real reasons behind what we're asking. I don't want to watch my coworkers leave because they want better opportunities. And when you really break it down in a simpler terms, like if you could do the same job at another place and get paid, $10 more, $5, or even $5 more, whatever the number, if you could do the same job and get paid better somewhere else or get better health insurance, would you do it? And I think most people would say yes. And that's all we're trying to convey.
Yeah, you want to be able to raise a family. You want to be able to rely on the healthcare. You shouldn't have that kind of such terrible healthcare when you are a healthcare professional. And I've heard that story about Kaiser so much about, that it will cost someone $10 to have a baby through insurance at Kaiser. And it's costing, if you're a Providence employee, $6,000, $6,000. And it's the same geographic area.
Yes.
It's just different choices that were made by the employers and by, the fact that for a longer time, we've had unionization. We represent the nurses and the techs at Kaiser, unionization at Kaiser. That's what unions do, really try and help people have quality, affordable health care.
I think something else that I would like Providence to understand is that the reason that we did all of this is because we care. We care about our jobs. We care about our patients and our communities. I mean, because this is especially for our group, to form this new union and get everything organized. I mean, it took a lot of work. It was stressful. It's been very scary. Nobody knows what's going to happen or come out of it. But I mean, we did it because we care. And we want to make this job sustainable so that people will stay here and we'll have good clinicians to take care of our community. Because I mean, sometimes I think, what's going to happen when, I'm retired? Who's going to be here taking care
of you?
Right?
Yeah.
We want to have people stick around who know what they're doing and be there for us in the future. And so we're taking this kind of current short-term sacrifice to hopefully make it so that things are going to be better for everyone, for the people who work there and for the patients who come in, for the foreseeable future.
Right. That's so important. And I was on the line with a lot of you last week, and there was honking and hooting and lots of people when they were passing by being very supportive. I was curious as to, are you feeling that from community members? Are you feeling that from friends and family? Are you feeling that from patients? Are you feeling that from the bigger community? Or are you feeling pretty alone out there?
Oh, no, I definitely feel it. Yeah, the honking is fabulous. I'm in an Oregon Physician Women's Facebook group. A lot of people have been supportive there as well. I've been very involved, right? So I think everybody that I know has been pretty supportive of what's going on. In the week, patients who came into the hospital were, giving their support too. You guys deserve to be treated well and respected because, they like the care that they're getting there.
Right.
Want it to continue. Yeah.
When you're walking that line and when you're thinking about your own life going forward, what does the solidarity mean when you see your colleagues with you? What does the solidarity mean when all of you took this action together? Does it have an emotional resonance? Does it feel hopeful? Or does it just feel like, we got to do what we got to do? And I'm curious as to how you're feeling every single day when you see so many patients and families and your colleagues all helping you or being together.
Well, for me, it's been extremely uplifting. The reason that I think a lot of us continue to work at St. Vincent's is because the people there are great. Everyone is really great to work with. As a whole, I think the whole hospital functions really well as a team. And sometimes I think that Providence takes that for granted. I really feel that sometimes that they feel like, well, I don't know, if 3 of you leave, we'll just get some other people in here. I feel like that sometimes they think of us as just like interchangeable little pieces. But I mean, I think we've really got a good thing going, a really like cohesive group as a whole. And so just to see everybody out there, I mean, it's just an extension of that. And it makes me think we do a lot together on the inside at work. We're going to be able to accomplish a lot together out here too.
Great. And Rebekah, what about you? What do you think?
It's great seeing people on the outside of their scrubs, a little bit different side of them, but yet we're still doing the same work. We're still working to take care of our patients and ourselves like we do on the inside. We look out for each other. And it has definitely increased some of the bonds that I've had. I've made some new friends. You see people that maybe you've seen them in passing, but you get to actually talk to them and learn what unit they're from.
With those heavenly donuts.
Yes, with those heavenly donuts. And it's nice because then we all get to talk. It really is unifying because we talk about our similar frustrations, our different frustrations, and we learn a little bit about each other's units and what it's like and some of the things. But then it all comes back to we just need to be treated better. Yep. We need Providence to actually work with us, and so that we can get back in there and do our jobs together.
So I just want to say to both of you, and I want to say to all of our listeners, this is who unionists are. This is who healthcare workers are. People are on strike. Rebekah and Lesley and their colleagues are on strike to make healthcare better in Oregon so that there's going to be more senior staff on Rebekah's unit so that she, after a year and a half, is not one of the most senior people on staff. Lesley, who has worked in St. Vincent's for 16 years, she wants the healthcare to be better for people. This is who people are. And we're striking for basic respect and voice and dignity and to make sure that we have decent health care and that the wages are competitive. And we're striking for our patients. And Providence should not have waited for a strike since November 2023 to actually start bargaining in good faith this week after a week on strike. But sometimes you got to do what you got to do, and having a union to back you up is what we're doing. So it's an honor. I just want to see if there's any last words you want to give to the people who are listening or to your colleagues on the line. Any last words, Rebekah and Lesley, that you want to share?
I would like to say, first of all, thank you so much for having us here.
Oh my God, it's my pleasure and honor.
And I just want to encourage everyone out there, when any union, but when your healthcare workers speak, listen. We're not just complaining when there's a problem, and this is historic. Doctors and nurses standing side by side. That speaks volumes that this is a systemic problem that we're trying to fix. We want to make big moves. We want to make positive changes for all of you and all of us, wherever you are, whether it's in Oregon, New York, wherever. When your healthcare workers speak, please listen.
So I would say, God bless both of you. Thank you for being part of the union. Thank you for being part of the struggle. Thank you for just kind of opening the curtain a little bit so that people can see the people who are healthcare providers at Providence, the people who are nurses and doctors and caregivers at Providence. If people want to follow what is going on in the strike, if people want to support us, one can go to the AFT website. And so follow us, support us, because nurses and doctors want what patients need. And what we're trying to do is actually do our best for patients, for communities in a very, very broken healthcare system. And that's why we're 5,000 strong, striking at Providence now, and one day longer, one day stronger, because we are fighting for a fair contract and fighting for the conditions that patients need in order to be well and be able to live their lives. So I just want to say to Rebekah and to Lesley, Dr. Lou and Nurse Van Dyke, thank you so, so, so much for being who you are and the caring, wonderful individuals you are. And for everybody who's listening to me, thank you. And this is Union Talk, and I'm Randi Weingarten.
I hope you enjoyed this episode of Union Talk. Remember to subscribe wherever you listen to your podcast and tune in every other week for a new episode. Thank you, be safe, and be well.